What is the best surgical and non-surgical or non-surgical treatment for saggy skin on the neck?
So how to treat a saggy neck? Well, did it say saggy? Okay, so specifically,
It did
had you
indeed, yeah.
just drunk a bit of wine?
I did, and I couldn't
And then I
swallow it quick enough.
So how to treat a saggy neck? I'm loving My Elevate. I'm just going to go straight in for the great guns. I'm loving My Elevate at the moment. So My Elevate is fairly new to me. It's something I was introduced to at the end of 2022 or the start of 2023, which culminated in me traveling to the States in 2023 to learn more about it and to go and visit Dr. Di Bernardino, which is not how he said it, but Barry. I don't know why I said it like that. I was trying to go for sort of very American accent. It did not work at all. Anyway, so I visited this fella who's doing an awful lot of My Elevate treatments, which are, okay, I'm going to list off a whole load of benefits. Minimally invasive, so there is no scar. You get 8 or 9 little stab scars, but they are so little stab scars that after 1 or 2 weeks, I, as the surgeon who knows where I'm looking, am struggling to find them because the neck also heals exceptionally well. So no scar, minimal downtime. So I saw a patient who had their neck surgery 2 weeks ago, and they are looking tight and sculpted and no bruising, and they're good for going out for a meal. Amazing. So no scars, minimal scars, no significant downtime. Can be done awake. You don't have to have it done awake, as it happens she didn't, but can be done awake, can be done under local anaesthetic with sedation. Takes about an hour to do, and I think that's quite a lot of benefits.
Yeah.
Oh,
fantastic.
fairly straightforward, painless. This patient was saying, God, it's just brilliant. What was she saying to you? She was saying, I just need to find the next thing to have done now because it was such a low barrier to entry. So I'm loving My Elevate. And what it is this incredible kit that has been designed by the very clever people at Cynosure, which allows you to pass. So first of all, it involves liposuction to debulk any fat. Then it involves, actually before that, it involves actually making a little cut in the muscle which forms platysmal bones. Do I have any? Not really.
I do, look.
Okay, show us yours. Yeah, you'd be great for this. So what you would do is you would cut the platysma band, that band and that band, but you do it through a tiny sort of puncture, a needle incision. I mean, I don't even want to call it an incision.
No, it's tiny.
And pass a stitch as a loop through the muscle, and you just sort of use that to cut it, and as it cuts, the stitch just re-emerges again, and then you do the same on the other side. Cut.
Is it because these bits pull the chin down?
Yeah.
These muscles, aren't they? And they
So
pull down.
The shortest distance between 2 points is a straight line. So if you've got this muscle that's all that separates and tightens, it wants to remove that lovely aesthetic angle of the neck and turn it into a sort of straight line like that. So by cutting that, you're just allowing it to sit back in. You're lengthening that muscle and allowing it to sit back in. That's the first thing. Second, liposuction. There's often a little bit of extra fat in the area, and that just helps to sculpt everything. And third, tissue tightening, skin tightening. So we will want and need to tighten the tissues in the area, and again, you can now do this through very minimally invasive ways, and I was talking about Renuvion. I love Renuvion for this purpose. Fourth, support. We're not going to rely on gravity, on your body's resistance to gravity to sort this out, because that's what got us into this mess in the first place, right? So your body has just shown us that it's not going to do the job, so we then place a suspension system, and that suspension system is a stitch that is passed all the way. So it's passed along this lovely angle of the neck, it's passed all the way back, it finds this bit of skin here. If you look behind your ear, there's a sort of hard bone right behind your ear. That is called your mastoid bone, and you have the stuff above it called mastoid fascia. That takes a stitch. Once you get a stitch in there, I could pick your head up off the operating table with that stitch.
Wow.
So that's a tough stitch. So you get it into this mastoid fascia and then back down again, and then it goes round and round. And that forms a long oval loop. And when that is tied and tightened, everything just goes whoop. It's quite a lovely moment.
I heard it described as a hammock. So it's
Hammock.
like a hammock for your chin. It just
hammock
holds it all up
Is a
and back.
great description.
Yeah.
Fantastic description. And that just leaves one knot, a single knot, which is buried and deep, hides under muscle, and well, that's it.
Yeah, it hides under your chin because you can't see it when you're.
Well, it's buried under the skin.
So, who is the ideal patient for this?
From the lovely Fozia. So, who's the ideal patient? Anyone really who doesn't like their chin appearance. I mean, if you feel you've got a sagging chin and you don't want to have a sagging chin, and you're worried about having invasive surgery or worried about the downtime, then this is for you. If you have a lot of skin excess, for the most part, what I've described is called a MyElevate procedure, and that doesn't involve skin removal. And for the most part, that's suitable for most people, actually. But if there's a lot of saggy skin, a huge amount that just won't redistribute, then you can still have this done, but you might need skin excision as well, in which case you wouldn't have no scars, you would have a scar. You'd have a scar around your ear going up to the back, where we hide that extra skin removal from. But for the most part, so I'd say that would be a less good candidate. Someone with really poor skin elasticity, I guess, might be a less good candidate. But that said, the wonderful, lovely Anoni did this procedure on a patient of ours who had experienced massive weight loss, and she's really, really happy with her outcome. So yeah, it really can be applied to most people. I can't really think of anyone who would really be totally unsuitable for it. So there you go. Hey, Miriam.
I guess it'd be people who don't have. Is it people who don't have enough? Or could I have it?
Yeah. So someone who's not suitable would be someone who really isn't worth treating. Yes, you could have it.
No, I'm just looking at this now and I can see a bit of chin under.
And that's it. Because it's the sort of tech neck thing. Because you've got a lovely jaw. Look, you've got a lovely jawline. Please don't think I'm trying to talk my wife into having. You've got a lovely, lovely jawline, but if you feel subconscious when you look down, and a lot of us are looking down more, and you get that bit, well, that will support it, despite the fact that you know, even when you are looking down.
Sign me up.
Anoni, because I can't do it
No,
for
you
you.
can't do it.
So Anoni.
There's
Okay.